Hi there, this is Brandon from Microquest, and today I'm going to go into a little bit of an overview of how the communications work within the PrescribeIT system. So, this was touched upon a little bit in some of the other videos, but the main way that we expect people to utilize this is actually from the doctor appointment view. So you can see I've got it open here and we have the PrescribeIT tab highlighted. So in this particular case, all of the communications that have come in for Dr. Bonner are here and available. And you can just flip through these as you would any sort of email or anything of the sort. Now, different message types display a bit differently. In this particular case, this is a cancellation request. So, we've sent off that this medication should be canceled, and we've just received notification back that essentially that was successful, but we have not yet had the pharmacy cancel it. So, you can delete those, you can archive them, whatever you need to do. All your renewal requests will come in here as well, and those will come in usually linked to a client along with the medication. If not, you can manually link those up as well. So most of the communication, like I said, will happen probably here, but it can also happen off of that patient's chart. So there's ways you can deal with those, and I covered those a little bit in the medication deep dive video, but you are able to do this communications off of their chart, and essentially works pretty much the same as off of the doctor appointment view. So with that in mind, we'll get into the chart in a second, but let's just go through this. So in this particular case, we have a prescription renewal request that's come in from the MicroQuest pharmacy for our Tommy test patient. And this is for his Axert medication. So you can see the information here that they've got everything that they're looking for, that you want to now renew that and get everything done. So if we click on this medication, it will actually open up charting in Healthquest and bring us straight to that medication with the renewal request here for Tommy. So as a physician, you can, if you need to make any changes, you can do so right here. You can also just renew it or respond to it and kind of move through as one would expect. Now, I mentioned that you can access all the communication regarding it. So yes, if we click the communication tab here, you'll see this is that renewal request. It's linked directly to this medication for Tommy Test, our patient, and you can see it all here. And you can see all the information and all the options that you have to deal with it. So let's just walk through those a little bit. If you want to redirect is used if you need to basically pass this request over to another physician within the clinic. So maybe you were covering for a physician for a day and saw some of their patients, and now you need, or now they need to kind of look over everything, so you can redirect that over to them. Approve all, of course, is going to approve all of the renewals within that. Now, in this particular case, there's one of two, so there are multiple ones. This would likely, the set codeine here will be the second one. So you can approve everything all at once, or you can deny everything all at once, or maybe you want to approve one and deny another, so you can respond to the request. In that case, it's going to give you the option here down here to see what you want to do. So yes, I want to approve the Axert, so we'll hit next. Then we're going to move on to the codeine. And this one, no, I'm going to deny that one. And you do have to tell why, and there gives you some options here as to what you want to do. So let's say patient must make an appointment. So we'll do that. So we'll e-sign and send, and there we go. Everything sends off to PrescribeIT, and that's it. That dealt with those renewal requests for that patient. So we flip back to our communication here. See, there's fewer. So as one would expect. So you can kind of just work through these as you would want. And again, you can do this. I did that through charting. You can also do it right from here. So in this particular case, let's just, we're going to approve everything here. It looks good. So we'll send it off. And you don't even have to go into the patient's chart if you don't need to. But there's shortcuts, of course, to get into all that, and you can do what you need to do. Healthquest, of course, will also just give you the options as to, that are available for the type of message that it is. So in this particular case, it's really just more notifications. So, okay, great, we'll just archive that. Same thing here, and so on. Now, this is actually a message. So this is a computer-generated message, so it's not a great message, but you can reply to it, and you can simply enter in whatever information you want. Thank you for this. And you can also attach items to it. So this is actually pretty neat. So if you needed something, some supporting documentation from the patient's chart, or if the pharmacy just needs, maybe some lab results or something, you can actually go through and hit attach, and it will give you everything that's available on the patient's chart. Let's just grab everything here so you can see. Well, they probably don't need medications, but let's say they need this lab result. So let's add that in. We'll add in a chart note with it and hit save. Now Healthquest just creates that PDF and attaches everything into it. Just takes a second here, and then, or doesn't, of course, when I'm trying to do a demo. But anyway, generally it will create that, it'll attach it, and you can just send it off and send your message. So it's actually pretty neat. And then you have, of course, two-way communication between the clinic and the pharmacy, so you can do everything that you need to do. You also don't just have to respond to messages. So there is, of course, the option to create a new message. In this case, let's say we want to send this to our favorite MicroQuest pharmacy. We'll choose that here. This is going to be about, well, of course, Monique Dixon. She's our favorite patient. So let's choose her. And if you can just make it generic about her, or you can actually link it to one of her medications. So we can actually choose that QVAR we did in the deep dive and choose that and say, dispense update. Please let me know if the patient is receptive. I don't know. That's probably not a very good message, but you get the idea. And once again, you can attach everything and do what you need to do and send that off. Now, dispense is probably not a great option for a message, only because you'll actually will get notification back, and it will show up in here when the medication has been dispensed. So you do know, and that's one of the biggest benefits of PrescribeIT, that yes, the patient took your prescription and actually went and got it filled and was dispensed. Unfortunately, we can't go so far as to ensure the patient is actually taking their medication, but at the very least, you know it has been dispensed, which is, I think, a step in the right direction. So with all of that, that's pretty much a pretty thorough, comprehensive overview of the communications aspect of PrescribeIT. Hopefully you found that helpful, and of course, just leave any questions or comments in the questions in the comments section, and we're happy to help you out with anything that you may have. So thank you very much for joining us, and stay tuned for the next video.